Welcome, Dr. Kristina. Thank you so much for being on our Spotlight series, The Best in Utah Pelvic Health. And we're excited to just jump in and chat all these questions and learn more about you and your practice. And before we do that, I'm just going to read a quick bio here so everyone knows who you are. Dr. Kristina Kill, formerly Stitcher, is a sought-after international speaker, consultant, and advocate for family wellness care through chiropractic. Dr. Kristina is the clinic director of Family First Chiropractic in Salt Lake City, Utah, and is the chiropractic coach and owner of Practice Evolution, which focuses on creating extraordinary family chiropractors. In addition to her practice, she loves everything outdoors, especially scuba diving and raising her 4 children. Amazing. Thanks so much for being on, Dr. Kristina. And I'm excited to jump into the questions right off the bat of like,
Okay.
what made you decide to be a chiropractor?
So I was raised medically. I say medically, like just traditionally is a good way to say that. With a last name Kill, you automatically are like, you should be a doctor. And it was like, yes, I should. And so I was exposed just to like traditional life and medicine. And my senior year in high school, my mom was involved in a car crash. She was T-boned at an intersection. And I grew up in Maine, so she was heading towards the coast, and she called my dad, and she's like, yeah, I'm okay, not really, but I need to continue to the coast. And so like that first day of school, I literally get pulled out after practice, and we drive down to meet my mom, give her another car, and have her continue on her trip. By the time she got back, though, she was in immense amount of pain and issues and everything else. So she went to the medical doctor, who got an MRI, who sent her to a neurosurgeon, who discovered that she had herniated a disc in her neck. And she was told, your only solution is a complete fusion of your lower cervical spine. And that was what she was told. And so that's what she did. And so I remember her being in surgery, in the recovery from surgery. And that's a surgery that was done in the late 90s. And so it's not like today where we just do the clips and the metal and the screws. She had a bony fusion. So a piece of her hip was utilized to literally be into place instead of that disc. So she was in a hard collar, and the goal was a hard collar for 6 weeks. She became 6 months. And then she was a soft collar for another 6 months. Like, she was one of the failures right away. And what I've learned later on is like 50% of spinal fusions fail, and they fail immediately. And she was one of those. And I remember with my dad asking the surgeon, how soon will she feel better? And this is like right after surgery. And the surgeon looked at us and goes, there's no guarantees. And I remember thinking, even at that stage, like, how do you do this? And so what happened was I ended up taking over my mom's part of the family business, and my dad's, like, it was a small family, like it's an oil company, which is so not anywhere here. Like, they delivered home oil. And so I ran my mom's part of the family business. I was in senior year. I was applying to schools. I applied to BYU. And it's a very prestigious school. I got in on early acceptance. And at the same time, I'm like, mom is not better. And I'm in Maine, which is like liberal college state. And I was like, I'll just stay in Maine and I'll go to school here. And my parents are very stubborn New England. And they're like, no, you will not put your life on hold. You go to school, we'll figure mom out. So I go to school, and a brand new chiropractor opened his practice in our hometown. And she went and saw him, and her health continued to diminish. She had then been diagnosed with fibromyalgia, chronic fatigue. Like, she really wasn't doing well. And the chiropractor sat down with her, and I share all this because of what he said. He's a brand new grad, and I think it's really important because sometimes, like, we're afraid of like that new beginning. And sometimes it's just when you're like most like, I don't know. And his answer was, your spine has been surgically altered. It will never be the same. But I believe your health can be better than it is today. And he put her on an intensive schedule of care to really allow her body to get to the best function it could have. And it changed my mom's life. And I remember coming home at Christmas time, and my mom's eyes were brighter. And that's what we get to see as providers, is like that light that shines. But I was stubborn. I was like, cool, I'm still going to be a medical doctor, and I'll like chiropractors, but I don't want to be a chiropractor because I want to be a real doctor. And so it took a couple more years of me looking at medical schools and then osteopathic schools and really starting to say, what do I really want? I actually went to the chiropractic school simply as a favor to my mom. I did not think I was ever going to be a chiropractor because I had this bias against them. So when people say I don't get it, I go, neither did I. Like, I'm so okay with that because I get this. And so here's what happened is I went to the school, total favor to my mom, thought I was wasting my time. And on the tour, I'm in the microbiology room where you grow the petri dishes. And it was like a 2x4 of inspiration that hit me in the back of my head that I was supposed to be a chiropractor. And there's moments in our lives that, like, you just know. And that was one of those defining moments of my life that it chose me. And the statement I say, and I still say all these years later, is I want to be a real doctor. Real doctors help people heal. Real doctors see people express life in the biggest way. I love being a chiropractor. And I love the fact that I went through this journey and I was a little stubborn to get into this journey because I think I can explain it differently and better and understand. And I think it's also why I bring a little bit more of a balanced approach sometimes to chiropractic, where sometimes it's like, oh, it's voodoo, and like voodoo, it seems like, which it's not, but it's really freaking cool. And yet we can bring it this mindset of how can your body heal? And it's a birthright of your body to heal without interference. How can I help that? And I absolutely love that is what started me on my path.
Amazing, amazing story. I love things like that. It's always fun to like hear that like genesis of everything.
Yeah.
Okay, next question. What do you feel like makes you and your practice different?
So I again, that's another, like, I love it. And so I'm celebrating 20 years, over 20 years in practice now. And so I got married right before I started chiropractic school. And so I knew I was going to be starting a family. So I immediately was in the mode of family mode, which is pregnancy and kiddos. And back then, it was not cool to see pregnancy and kids. Like, our chiropractors are extremely medical and rehab based, and that's really what was known in the profession. And so I did a ton of training. Before I even left chiropractic school, I had a fellowship in pediatrics and in pregnancy. And so I came to Utah and I was told by every chiropractor I talked to that there was no way I'd be successful seeing just kids in pregnancy. I know, it's birth capital of the world. Like, seriously.
I know. That is mind-boggling to me. I'm like, wow.
I know. And so, and it's also mind-boggling because there's just such a need for it. And so luckily I didn't listen to them. And I opened my practice, specialized in pregnancy and birth from the very beginning. And what happened, and this is like the thing I love, is that there's doulas and midwives that found me that said, I've been looking for someone like you for 20 years. And it's like, oh, that's cute. And the answer is no. That's how desperate the need was. And just someone wasn't willing to come and be like, and here it is. And I shouldn't say just like, Christine Phillips was already here. Like, she was blazing a trail, and just, they didn't know about her. So it's like, it's getting the word out and getting around, but there were so few of us and so few females. Like, I could count females in the state on one hand when I opened my practice. And so I got to be known immediately. Like, I pigeonholed in a beautiful way, pregnancy and kids, because they desperately needed the care. And what I've done is I've had my own evolution in my practice to say, you know what, I love pregnancy and kids, and I was going through it. And as my kids got older, I actually saw the need of older kids and what was going on. And then as I got older, I saw the need that, like, I need more love and care as a mom and a postpartum mom, and now as a middle-aged mom. But I acknowledged about 10 years ago, we weren't seeing the dads. And the dads were deciding based on financials and schedules, not based on need of what their kids and their wife should be doing, instead of getting it. And the joke is the men are like the last to come in, and they're going to wait until they have a health trauma themselves or a health condition. But what I did was I consciously changed everything in our practice to family wellness care. And when we did that, we got dads and partners to come in from the very beginning, and they come in and they're like, this is amazing. This is the best thing ever. Like, this is best decision we've ever made. But the reason I'll say this is like the beautiful thing that I love. When I sit down with a mom and I explain what's going on with her health, and you see this all the time, they're thinking in their head, when you especially when you give a schedule, because you and I totally agree on schedules that are restorative and function. I don't want you just to feel better. Yes, I want you to feel better. Desperately, I want you to feel better, but I want you to function better. I want you to heal. I want you to express life. And that's going to take more work, but that's like the golden ticket. Yeah. But when a husband or a partner could hear that and be there, the wife is thinking, and I'm just doing traditional gender roles just to help make this like what I saw at the beginning. The wife is going inward, going, can we afford this? Am I worth this? And 9 times out of 10, I would watch the husband like do this. Baby, we've got this. You are a priority. You need to take care of yourself, and don't you worry. And it was this most beautiful thing that I've seen time and time again, that as wives and as moms, we just kind of take on this role and we put ourselves last. And when you give yourself that space to be a little vulnerable and to have that support, you watch your partner just rise up and go, baby, like you are the most important thing, which means we're going to prioritize you because you always were a priority. And I watched families grow closer together. I've watched families heal through some major issues. When one person's unhealthy, the whole family's impacted. And as one person heals, the whole family heals. And then what happens is the whole family starts care because not because they have issues, but because they want to be their best health and express their best health in life possible. And that's really, really what I do is family wellness care. We do corrective care to get you there,
Yes.
but then we celebrate long-term life and health where you're coming in to keep yourself at your very best.
Amazing. Amazing. Okay. Who would you say is an ideal fit for your practice?
So you can see like it's changed. And I think that's what's really cool. Is like our ideal fit is really, I always say it's a reflection of where we are. Right now, I love like where I am, like this stage of mamahood where we have our kids are a little older, and then we kind of look around. And I did the same thing with you, Betty. It's like, I'm happy to say this. Like I have loved my investment in time with you. Is I looked back and it's like, hold on, this postpartum body still isn't where it should be. And I'm not okay with that. And I have the ability to think and breathe because I'm not such in survival mode anymore. And I have the ability and time and investment to really dive in.
Yeah.
And that's really who's become like some of my favorites because I can just hold and love. And I have like 15 personalities because then I get these new moms or these pregnant moms that just need to be loved. And then these babies that truly are disconnected. And it's like, this is a trauma thing. And that's not the best word. This is just, it's a space that needs to be held. These babies are coming into the world already in nervous system dysregulation. And their pediatricians are telling them they'll outgrow it. And the answer is no, they'll grow into their new thing. They'll grow into their next thing. And so we're standing here going, no, nervous system's everything. Brain controlling the body is everything. And if it's dysregulated from the beginning, nothing replaces the fully functional nervous system. So when we get these babies, it's like, I've literally had moms and dads that will hand me a baby. They don't know who I am. They've been referred into me. I come into the room, I introduce myself, and they hand the baby to me. Like, talk about this just trust that's already there, because some of them, it's the last thing. And these babies have been sent home with failure to thrive, or been sent home and the medical community's done this and go, well, we don't know how long they're going to survive. And then they find someone like me who specializes in these really tough cases. Like I'm known for tough cases. And they hand these babies or these kids off to me, and pretty much just like, whatever we got to do. And I'm like, we're going to do a lot. Like, we're going to do a lot because a lot needs to be done in a very succinct way, in a very scheduled way, in a very beautiful, like not more to, but more for. And then miracles just like, you know, when you see it, you just can't like deny what we get to be part of. And it's just, I love it all. I love it all because I see life expressed. That's my ideal client, is someone who wants to express life.
Love it. Love it. Okay. What does the process look like to work with you guys?
So we're value heavy. And so when I say that is the phone call in, you're going to know a lot from the, like, don't do the phone call for 2 minutes. Like my team's going to tell you what's to expect as you go through. And we do like a 3-visit procedure to get started, because I'm a huge believer in knowing what's going on before we do anything, and having complete confidence in what we're going to do and a complete agreement of how we're going to proceed. And so the phone call is going to prep you for the visits, but the first visit is a consultation. We're going to sit down, we're going to dive deep into your health long term, what's been going on for a really long period, how it's affected your life, what really is happening within your nervous system, and how your nervous system is the master command center of your body. So we're going to ask a million questions. We're going to do a complete in-depth exam. I have so many people that sit down with that exam and go, I've never had such a thorough exam, including all the neurologists I've seen, included all the specialists. I go, because we look for function. And if you can pass that exam, that tells you that your nervous system's functioning at an appropriate level. And what's shocking, and you know this, Betty, is like that exam is not a difficult exam, but 90% of people fail that exam. Yeah. And that's why they're not healing. That's why they're not able to function like they should. So that's going to be your first goal, is to get you to pass that exam. But we do a really in-depth exam. We do neurological scans. We do x-rays when appropriate. We do additional brain scans as appropriate. And then we sit back down at a different date and we put all this together. And we really help people understand how your health has led to where you are now. It's not an event that just happened yesterday.
Mhm.
So it took time, it took patterning, good patterns and bad patterns, I always like to say compensation patterns. Our nervous system is meant to adapt, but when
Mhm.
it can't adapt, it's going to break down and compensate. And thank you, it kept us alive. It did exactly what it needed to, but we need to now change that compensation pattern to now health and function pattern. And that takes time and repetition. And so we're going to say, yeah, you love, it's like, you and I are so, I love it. I love working with you because it's really one of understanding. It takes like, we know everything takes time, and yet we all want this, but
Yeah.
we forget that this isn't long-term and this isn't sustainable. And I want sustainable health. And I'll even hit it, like some people say, it's like, well, I have to go to a chiropractor. It's like, I gotta go like forever. And my answer is no. You can choose to come forever if you want to. Like I see people who've come to me for years. I'm not going to make anyone come to my practice. And I don't have some voodoo sense that the adjustment's going to go away in 2 weeks either, but it is going to take a schedule to retrain those patterns.
Yeah.
And to retrain the brain and how it's been firing to function, well, firing to survive.
Mhm.
And now we're going to help remove that interference so that now it can fire to thrive.
Mhm.
And that does take time and repetition and love and support and a space of healing that your body knows it's safe to heal. So we sit down and we go over all that and all your options. And then it's one of saying, you let us know, because I am not one that plays like any of the sales pitch games that can happen and that people are afraid of. It's like, no, here it is. Here's what's going on. Here's what's going to cost. Here's what's going to take. How do you want to proceed? Because I'm a huge believer in it's got to be your choice and what you want to do. And it's really important to let you make the choice of your health. Choosing in to take care of yourself is a huge choice. Choosing to not take care of your health is also a huge choice. And I don't want to take that away from people. And I really want to empower people in what they're doing in their lives and where it can fit in, or the time, or to prep. Some people say, I can't do it right now. What can I do in the meantime? There's ways, like there's always conversations around that.
Yeah, love that. Okay, next question is, what does recovery look like in the sense from like pregnancy to postpartum in your, or even for baby from being born? Like, what does that recovery process look like, or what's your ethos around that?
So I love seeing women during their pregnancy. Like it's really one that we find that women under regular chiropractic care have faster, easier labors and birth. They recover easier, they recover faster. What we do postpartum stage is that we have these moms that have already been under care. We have them come in once a week. And we do that for the first couple months after they have their baby. And so many moms are coming in going, I think I'm just sore from birth. And I'm like, yeah, you probably are. And let's get you adjusted. And then as soon as they get adjusted, like, oh, like seriously, this is like 90% gone. I'm like, yeah, because your body just needed the extra love and support. And then what we're able to do is help to see them through. The biggest thing I'll say is that we can take on and really support is that it helps them heal faster. It helps their body connect. It also gives them a space and place that really allows for these postpartum times that can get really hard
Mhm.
to potentially show up. We know that as you get adjusted, nervous system's going to regulate, which means hormones going to regulate better. Your tissue is going to heal. We're not going to go to scar tissue. Like we're going to be able to go to organized tissue that heals like it should. But I'm going to go back to the hormones for a second, because I think part of it is we have these huge waves of hormones and we're kind of like, well, it's just what it is. But what if it doesn't have to be huge waves? What if your body's actually trying to find itself and it's struggling in that finding? And then it can lead to postpartum depression, and it can lead to other postpartum issues that can get even more serious than just depression, which is already a very serious condition. I actually love the fact that we're one of the only providers that people are seeing on a weekly or every other week basis, because then we can sit down and we can engage and we can give resources and we can give support and we can give love, or we can just say, okay, we're at crisis and we're going to call in some crisis lines and we're going to get some help. Like I own that space, because it's really one that I'm like, that's my responsibility. When I have the opportunity to take care of moms postpartum, I better pay attention to that. Then for baby, there is no doubt that the babies that are born under chiropractic care, which means mom was receiving care, those are healthier babies. Like it's just like, it's tried and true. It's crazy the difference. These babies often need like a tune-up, and we're checking them once a week as well, because we kind of see things will show up in those first 8 weeks if there's issues, or there was a tough birth, didn't quite go the way that we were planning, and we can do some more repair work. Their schedule may be more involved, but they seem to clear through. Even like if they're under care, those babies clear fast. Like their nervous system's already regulated, because their nervous system follows the pattern of mom's nervous system. So if mom was regulated in pregnancy, then baby knows a regulated nervous system. The flip side is we often have these babies that are coming in, they're the first patient into our practice, which means no one's had chiropractic care. Baby's been born, highly dysregulated, can't eat, can't sleep, can't poop. We're talking about colic, we're talking about reflux, we're talking about they can't nurse on both sides, like major things that can be a failure to thrive is a major issue. And they need a lot of care.
Yeah.
And it's one that I make no apologies for it. I have some parents that go, well, they're 2 weeks old. I go, and they were growing for 10 months. And they
Mhm.
were growing in a state of dysregulation for 10 months. And that doesn't mean you did anything wrong. It just means that we got to own the fact that that's the environment that they were being born and created and
Mhm.
patterned in. And now we're actually helping their nervous system learn normal, see what it looks like, feels like. And that makes us keep a close eye on these babies, but
Mhm.
they thrive. And I keep a close eye on babies because I want them to thrive as quickly as possible so
Mhm.
that they can return to a state or come to a state for the first time ever in their lives where they can eat, they can sleep, they can digest, they can poop, they can do these normal life survival things. So now they can grow.
Mhm.
Now they can thrive. Now they can connect. Now we can have relationships of bonding. That all of that was robbed when baby's stuck in survival.
Right, right. Beautiful. Okay, next question. What is something that most people don't know that you think that they should know about anything? Or-
Oh, I love that. I think most people discount chiropractic because and I'm going to own it. Chiropractors has pigeonholed themselves into back pain, neck pain, and we go, but we're so much more. And I go, then let's explain so much more. But there is a bias. There's a medical bias.
Mhm.
There's a joke with PTs that we all hate each other. I'm like, actually, I get along extremely
Yeah.
well with.
I got asked the other day of like, what's your stance on chiropractors and PC? I'm like, how do you not know this? I love them.
I love And so I think it's just one that there's no doubt if we go through the history, there was an active campaign against chiropractors in the 50s and in the 60s. And there was a lawsuit that was started in the 70s. We won the lawsuit because we were being targeted by the AMA. It was ugly. It was disinformation. They really wanted to shut us down. That's how they shut down naturopaths. That's how they shut down herbalists. That's how they shut down acupuncturists. Like they did their job well. And it really has been the detriment of our health. And as chiropractors, we luckily fought back. And so now I say within the profession, what is unique? I hope people would say is give it a chance, but know that there's differences. I'm very brain-based. I'm very nervous system focused. I'm corrective care in what I do and how I look at the body. The body can heal, can repair as long as there's no interference. And if you want your kid or yourself and you're pregnant or in this family mode, you better see someone who specializes in it. That we're not all the same. And it's a different training that we take. I now travel the world to teach this because it's not taught in schools. You get basic OBGYN in school, that's it. And so it's not the same. And to go and see a chiropractor who sees a lot of adults and assume that they are going to be able to take care of your kid could actually create a situation that you are not going to be very happy with. And so my answer is all the doctors that I know, there's tons of them now in Utah, and I love this, and I help us get it together on a regular basis is what we do because I love to support the profession. None of us take insurance. And so a lot of people are just like, because we're outside that model of back pain, neck pain, and we're into life models. So it's like a lot of people are like, and I'm like, no, invest in health and invest in what's best for you and your family. But you need to see someone who regularly sees kids, knows kids, loves kids, and knows pregnancy, has the right equipment for pregnancy, is not going to lay you on your side and do a side posture adjustment when you're pregnant. Like it drives me a little batty and nuts. And they're not going to take your baby and treat your baby and adjust them like they would an adult. Way different, you guys, way different. When I'm adjusting a baby, the pressure is like pushing on your eyeball. It's soft, it's gentle, it's profound, it's specific, it's done incredibly well, and it's life-changing. And so you have to invest in the right people, find the specialist because it is the game changer.
Yeah, awesome, awesome. Okay. Is there anything special you want to promote that you have going on or anything like that?
No, this is what we do. And I honestly will say, like over 20 years in practice, I have really just stayed really clean to my purpose and intent. And it reminds me on a regular basis why I do what I do. And I don't play the game of, I really try to be good at not being distracted because I know that the need is great in our communities. And by serving families, we see miracles and we witness miracles on a regular basis. And so I stay there because it keeps me grounded. It keeps me excited. And it's one that it really impacts generations. And that's huge.
Love that. Okay. A last question, my favorite question. What do you want to be known for?
I'm a huge legacy person. My dad passed away very unexpectedly 10 years ago, and his funeral was like outpouring of love. People coming from all over and sharing major stories of my dad just like showing up on the side of the road and just being this amazing, amazing man. And I learned so much from him. I want to leave this profession better than I found it. I want chiropractic to be better because of me. And that's why I give back to this profession so much.
For sure.
But I want my community to be better because of me. I don't want to sacrifice me. I'm learning that, like I'm really learning that, that I don't have to sacrifice me to do this. I think that's something that we all get to learn as business owners and especially moms. But I love this. This feeds my soul. And so what I want to be known for is the fact that we're like, I left an impact. I left a ripple effect. And it's a ripple effect that I don't know how far it goes, but I'm okay casting that stone in a beautiful way to say, you know what? Let's just start the process. And I've been through some big things in my life, and I'm a huge optimist. And I grab life in a big way. And to me, this is the best thing that I get to come back and go, hey, like, what a great way to live life is live it big and large and really connected.
Yeah. Amazing. Amazing. Well, where can we find you? Website, social media, all the things like that.
Love it. Okay, so the name is Family First Chiropractic and Wellness Center. We are technically in holiday. We're just barely past Murray. Don't let that scare people. We're just off 215, you guys. Like super easy to now get to us. So the website's utahfamilychiro.com. Social media, I didn't even think of those. So I want to say it's family.first.chiro for Instagram. Right. Yeah. And it sounds about right. Facebook, no one follows. I use Facebook to get to Instagram, like everyone does. It's really one that do a good Google search, but you got to hit that and Wellness Center because Family First Chiropractic isn't just us anymore, or Family Chiropractic is another one. Great man, great doctor, but Family First Chiropractic, I've had that for a good long time. And it's not just me. So you saw my name change. I will say that Stitcher is like what I've been known for. And I appreciate that journey. And I've reclaimed my maiden name. So it's Kill. And then I have two other doctors that work in my practice, Dr. Lawrence Hapley, Dr. Alyssa Rimkus. They've been with me for like 7 and 8 years now. It's just like, it's really one that we are here to give back in huge ways. So find us and see how it fits. I have people that will fly in and spend a couple weeks with us, and then we find someone for them down the road, especially parents, like as postpartum stage, you're being taken care of. They'll come in and see us and we're like, nope, we want you to find the best providers you can. And I know the providers in the state extremely well. And so if you go, oh, who's good in my area? Call us. We will happily tell you who we recommend. We know we're not the best fit for everyone because of time, distance, whatever it could be. But I really believe that finding the right fit in your providers is huge and it's important. And I've been seeing patients for over 20 years now. It's like they choose to come in year after year because of the relationship we've built. And that's really like, that is so cool. And it's an opportunity that people have to really choose, how does this fit into a healthy lifestyle?
Yeah. Amazing. Well, thank you so much, Dr. Kristina, for coming on the Spotlight series. It was a pleasure chatting with you again, and we'll see you soon.
Thank you so much.